It's our COVID-19 briefing for British Columbia for Thursday, August the 13th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Just in terms of the schedule for the coming number of days, on Friday we'll be delivering a written briefing of the case counts and other relevant information for the day. On Monday from Vancouver, I'll be giving a briefing with Dr. Reka Gustafson, the Deputy Provincial Health Officer and Vice President of the Provincial Health Services Authority. Today also, Dr. Henry will be presenting modelling information for your information. We've previously provided modelling briefings on March 27th, April 17th, May 4th, June 23rd, July 20th, and now today, August 13th, and we'll continue to do so to ensure that the people of BC have the information that we have when decisions are being made. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. We'll start with a case update for today. And today we have 78 new cases for a total of 4,274 people in British Columbia who've been diagnosed with COVID-19. That includes 1,306 in Vancouver Coastal, 2,242 in the Fraser Health Region, 150 people on the Vancouver Island Health Region, 398 people in the Interior Health Region, 106 people in the Northern Health Region, and 72 people who reside outside of Canada. We now have 578 active cases in the province, of whom 9 people are hospitalized, 4 of whom are in critical care or ICU. We have no new deaths to report today, thankfully, and we have 3,500 people who have recovered from COVID-19. Currently, there are 1,878 close contacts who are in isolation and are being actively monitored by public health because they have been exposed. And they are in all health authorities in the province. We have no new outbreaks in our healthcare system today. There are 7 that remain active in the healthcare system in both long-term care and 1 in acute care. We now have 679 cases, so 409 residents who have been affected and 270 staff. There's 1 new community outbreak at the Okanagan Correctional Center in Interior Health, and you will recall we had a small outbreak at that facility a number of months ago. There are 3 staff people involved at this point, and the investigation is ongoing with the Correctional Services as well as the PHSA Health Services and Interior Health, and they have full outbreak protocols implemented in the facility. Health authorities continue as well to issue community exposure alerts for numbers of locations that we know are across the province, and also for flights coming into and out of BC where there have been people diagnosed with COVID-19. So please check on those health authority websites or the BC CDC websites and follow the advice that is provided there. So I will turn now to looking at some of the numbers and updating people on the epidemiology and some of the modeling, and also some of the information that we've obtained from you around the impacts of the pandemic and the measures that we've put in place over the last little while. I'll talk a little bit about the epidemiology. This is a profile of the last week that we've seen. As we know, we've had a steady increase in new cases over the past week, and along with that, what we've seen is a decrease in the median age of people who are being affected, and I'll talk a little bit more about that. We have 550 people now who've been hospitalized, 8 new people, and again, the median age for hospitalization remains in the high 60s, and we have had a single death in the month of August, and the median age, of course, for people who have died remains quite high. This is our epidemic curve, updated to the end of last week, and this is by reported date, so that's the date that the test was reported. As you can see, we have a number of epidemiologically linked cases and laboratory diagnosed cases, and we've seen a steady increase in those cases, particularly since the beginning of July. Looking at them, however, by date of onset of illness, which is something that we do in public health when we do these case investigations, and we also look at where people have been exposed. And so this epidemic curve shows this by likely source of infection. And what we can see is that most people are related to local cases and clusters. And this is the work that we're doing. We talk about contact tracing, being able to find people who have been exposed and make sure that they're in isolation. And that's how we stop those chains of transmission. So there are very few people who we don't have a link to in the province, despite our increasing numbers. And that's really a testament to the work that's being done by public health teams around the province. I will also note that we do continue to have introductions into the province from international travel. Some of these are our temporary foreign workers who have come in from countries, particularly Mexico, and a number of them have become ill while in quarantine. And as you know, we have been providing quarantine support for all of the temporary foreign workers coming into British Columbia for 2 weeks prior to them going to the farms. And that has, I think, averted a number of potential outbreaks in farm settings. As well, we continue to have Canadians returning from other places around the world, including recently a number of people returning from India, from the US, and we have had a number of cases related to that as well. This is an update of the geographic distribution of our cases by health service delivery area of where the person resides. And again, you can see that all areas of the province have been affected. And though we've had increases in particularly interior health, the bulk of the cases still are located in the lower mainland of British Columbia. When we look at the age groups, and this is something that we've been looking at and following over time, but what you can see from this figure is that we've started to see a rapid increase in the last few weeks in younger people. And that's reflected in some of the numbers that we're seeing, as well as the discussion we've had over the last few weeks of exposure events, particularly social events, parties, get-togethers where younger people are coming together and the virus is being spread. The top line in the sort of dark pink is the 20 to 29-year-old age group, which we can see has gone up the most. And the green line just under that is 30 to 39. And we're now seeing that the proportion of cases by different ages has shifted. And in this graph, you'll see the proportion of cases in different age groups by phase of our pandemic. So the first bars represent January to May, January to middle of May, and we can see it's fairly evenly distributed. What we see is a preponderance of older people, and as we recall, many of the people who were infected early on reflected the outbreaks we had in long-term care homes. So there was younger people who were the healthcare workers providing care, and older people. And as we moved into phase 2 of our pandemic here in BC, we got a hold on some of the issues around long-term care, and we started to see an increase in younger people. And that was reflecting transmission events that we were seeing and some of the outbreaks we were seeing in workplaces, some of the poultry plants, for example, the correctional facilities, and younger age groups being affected. And now, between June and August 8th, we've seen a much broader increase, particularly in people in their 20s and 30s, and this is again related to some of the social events. There is still, of course, people reflected in there from workplace exposures, including healthcare workers, but it is also being driven by what we're seeing with people gathering and having social connections where this virus can be transmitted quite easily. These two graphs give us a better sense of that. When we look at the one on the left is under 20 years of age, and then from 20 to 39. And what we see over the 3 phases of our pandemic here in BC is that we've moved from having household contacts and being involved with outbreaks to having a shift in the connections and the exposure sites where younger people are getting exposed and infected. And what we call those our other known exposure really refers to places like bars and clubs and parties and social events that we know have been an issue in the last few weeks. Wanted to present some information around the ages of people who are getting infected in our province, not only to reflect that we are seeing a disproportionate increase in young adults, but also to remind people that we monitor very carefully for younger people as well, and we still see a very few infections relatively in children, particularly children under 10. We're now up to 78 children under 10 who've been diagnosed with COVID-19, 2 of whom were hospitalized. And so this reflects about 2% of our cases in the province, whereas children under the age of 10 are about 9% of our population. So they're underrepresented. Same goes for older children, 10 to 19 years of age, where we've had now 162 people diagnosed. And again, that's 4% of our cases in a population that represents 10% of the proportion in the population. In both those cases, very small numbers. Only 3 out of the entire group have required hospitalization. We've had nobody who's needed ICU care, and thankfully nobody who has died. We can also see that we've started to see a shift in the young adult age groups, where they make up a disproportionate now proportion of our cases, where 17 or 18% of our cases are in those age groups compared to their representative in the population of being only 13 or 14%. We have, of course, had an increased representation of older people in our cases, and we know that reflects primarily transmission in long-term care homes. And then you've seen this before. This is the distribution of our cases, people who were hospitalized, people who ended up in ICU, and deaths, and comparing them by age. So the first bars that we see on the far right are the proportion of that population or that age group that's in the general population in BC. So for those under age 10, it's about 9%, as we said, and the proportion of cases. We then move on to see that hospitalizations are very rare in young people and even in young adults. And we have had very few people who required ICU care, and we've had no deaths in anybody under the age of 40. The deaths, unfortunately, are heavily skewed to the older population, particularly people over the age of 80. Some of the things that are really important for us in being able to ensure that we can detect cases and manage outbreaks and clusters as they occur is our laboratory testing. And so I've presented a little bit of information about the tests that we're doing per week, the capacity for us to test, as well as our turnaround time. And as we can see, our numbers of tests are going up again as we are finding more people who've been exposed, and we're encouraging people to be tested with any symptoms at all. We've done, just today, we did another 3,800 or so tests in the last 24 hours. Most of the tests that we are seeing, the turnaround time is less than a day. There are some areas where testing has been increased quite a lot, and that turnaround time may be a bit slower for periods of time, but our lab capacity now is good, and we are continuing to build out our lab capacity as we go into the fall, and our intent is to be able to have rapid access to laboratory capacity at about 20,000 tests per day across the province. Some of the things that we have been following, as you may remember, is some of the modeling about the connections that we're having in BC and where that is putting us in terms of potential for the outbreaks to grow. This is our mobility data, and it shows again that we are slowly but surely increasing our connections in our communities. I'm particularly heartened that we're continuing to increase our use in parks and green spaces around the province, and I think that's a very positive thing. But we're also going to the grocery store, residential areas, retail areas more, workplaces and transit are increasing as well. And we know that as we increase those connections and those pieces in our community that are so important, that includes us connecting with others as well as our economy, that we need to do it in a safe way, or we risk transmission of the virus on a broader scale. And the modeling that we've been doing, the compartmental modeling, helps us understand where things are and where things could go in the future if we don't take the actions and the measures that we know work. So we have been bouncing around a little bit above 1 in our reproductive number. So that is the average daily number of new infections that are generated per case. And we know that we want to be under 1. We want to be sort of hovering around 1. That means that we're opening up as much as we can without putting things in risk. And we are able to do that. What we see in this is that when we pay attention to it, we can bend that curve back down. And we are now starting on a bit of an upwards swing again, and we need to pay attention to that. When we look at the modeling, and I've shown you this before, this is an extension of the projections. It shows that, no surprise, as we knew, as we started to increase and open up and move into our restart phases, we were going to see more cases. But what we need to do is make sure that we are having, that we're still able to manage those rapidly through our contact management, our case management. And what this shows is where we are. We are on an upward trajectory. That is concerning, but it's not a predictive model. It doesn't tell us what's going to happen. It tells us what can happen. And right now, we have it within our ability to make the changes we need to bend that curve back down. And this is the graphs that you've also seen before, the scenarios that we could see in our future. So we're probably somewhere in the scenario that says contact rate at 70% of normal. But we can bend that curve back down by making sure that those contacts are safe. And that includes things like our safe distances, keeping our numbers small, making sure that in those times where we can't maintain those distances, we wear masks. But most importantly, it's about staying away from others when we're sick, minimizing those opportunities for this virus to spread rapidly to large numbers of people. Part of how we are able to manage, despite the fact that we're seeing increased numbers of people who are testing positive, is because we have very active teams that are managing every single case and every contact that has been exposed. And we know from our modeling that we have scenarios that help us understand how we need to do this and how we need to do this efficiently. So we are in that place right now between moderate, which we were doing very well. We had quite strong to moderate physical distancing or social distancing measures in place. We're now moving towards the weak social distancing measures. And part of that is us being able to open up and restart our communities and our economies while living with this virus. So we are at the point right now where it's really important not only that we find everybody, but we do it in a timely way. And that is one of the reasons that we are bolstering our teams of people who work on contact tracing in public health. There are people around the province every day doing this work, and we're going to be supplementing that with other people as we announced yesterday. And again, this scenario tells us that complete contact tracing helps ensure that we can continue with our restart, we can continue with our surgeries, we can continue with our visits to long-term care, people getting back to work and opening our schools if we have our strong public health system in place as well. So as we have relaxed our measures to open up, strong contact tracing has provided a buffer. And we need to continue to provide that buffer, but we also need everybody to do their part to minimize the number of cases that we need to follow and minimize the exposure events because the two of these need to work together to keep us on a flat, steady line for the next few months. Finally, I'm going to give some of the information that we learned from what you gave us in the Population Health Survey, Your Story, Our Future. I think this is incredibly important for all of us to understand how the pandemic and how the measures we've put in place have impacted our communities across BC. And this is just a reminder that we had over 390,000 people respond to this survey and tell us how it was affecting them from all parts of British Columbia. So one of the most important things we needed to understand was how the impact of these measures differed on people of different racial and ethnic backgrounds. And that was one of the important reasons we asked those questions in this survey. And as we can see, there was a differential impact on racialized populations in British Columbia. Not a surprise to us, but it is something that we need to pay attention to. We've seen around the world that this virus and the measures that have been taken do expose some of the differential impacts or some of the inequities in our communities, and we're no different. We see that that West Asian, Latin American, and South Asian respondents were more likely to report increased difficulty meeting their financial needs during this period of time, and more likely to report not working directly because of COVID-19. Whereas Caucasian respondents had less difficulty making ends meet, fewer were not working, they were less likely to avoid healthcare and had less food insecurity. The other areas we looked at were around difficulty accessing healthcare. And again, we see a differential where 30% of Japanese, Korean, and other South Asian respondents were more likely to report having difficulty. And also we see some positive things that are different by racial and ethnic backgrounds, including the fact that Latin American, Southeast Asian, and Black respondents were more likely to report an increased connection to family, which is a positive support and helps in terms of resiliency when these measures are happening. The other concerning thing, Caucasian respondents were more likely to report things like increased alcohol consumption, which can be concerning in terms of helping to cope with the measures that we've seen during this pandemic. We've also been looking at the impacts on people with the lower income, by income, and we do find that individuals in the lower income strata suffer more negative economic and health consequences from the pandemic. In particular, they had people in the lowest income level had difficulty meeting financial needs, where up to over half had concerns in that area. 40% were food insecure because of the pandemic, and a quarter of people in the lowest income bracket were not working due to COVID-19. In addition, people with lower income were more likely to have chronic health conditions, experience increased concern about their health, were less able to stay home from work when they were sick, and this reflects the jobs that they were in, and they had more difficulty accessing health care. The other thing we wanted to understand more of was the impact of households that had school-aged children and whether there was differences by racialized groups on those households as well. And what we find in this is that although a number of racialized groups were more likely to report that children experienced impaired learning, what really strikes me across the board, all parents, 2/3, 3/4 of parents with households with school-aged children reported that their children had challenges with learning during the past few months. We also heard from parents that 78% of them reported decreased connections with friends that was concerning, and 59% reported increased child stress. This, of course, was reflected again among economic differences in the households. Though across the board, 76% again had children's learning was impaired during the pandemic, 78% of people reported decreased connection with friends, and again, 60% reported increased child stress. So these are all important considerations for how we move forward and the decisions that we're making for the coming weeks and months. So that is the update on the numbers for today. And I think what this shows all of us is that this pandemic has created incredible uncertainty, anxiety, and many challenges. But the challenges have not been shared equally. We know it has affected communities across British Columbia, but we know it has differentially impacted those of lower economic status, people in racialized communities. And we now have to look at how can we support communities across BC to move on, to recover from that, and to build back stronger and more resilient. We know a lot more about this virus now than we did in March. We know as well about the impacts of the measures that we put in place in March and who they're affecting and how. We need to know, to continue our job, all of us, to slow the spread of this virus, because we know that is how we can best address the inequities that have been created or been exposed over the last few months. It is about minimizing our risk of transmission of this virus, working in public health to manage the cases, the outbreaks, the clusters as they arise, and to modify our behavior as we find out risk situations. And we've been doing that, and we need to continue doing that, all of us. Our actions make a difference. Our actions can inspire others to do the right thing. We need to all be role models in our community, in our family, to use the tools that we have to support all of us and keep our communities safe. And we need to do it every single day. And we also need to ensure that we continue to be kind and to be calm and to be safe. Thank you.
Thank you very much, Dr. Henry. And I think, first of all, I want to start by acknowledging that while no one passed away from COVID-19 today, that someone at Holy Family Hospital in Vancouver passed away in our report yesterday, our written report yesterday. I want to acknowledge that and express our deep condolences to the family. I think today's data illustrates what the broader review and the broader modeling discussion and the analysis that Dr. Henry has just presented shows. We had a significant number of cases today, but the number of people in critical care went down. The person who passed away yesterday was the only person who passed away from COVID-19 during the month of August in BC, a period where, for example, in Alberta, 24 people have passed away. So we are making some progress in some areas. There were no new resident cases in seniors' care. But let's be clear, higher case numbers put everyone at risk. They do. And we need to take steps to deal with those higher case numbers in the coming days and weeks ahead of us. And while that presents requirements for public health, it also puts requirements on all of us as citizens of the province. I want to say that after this presentation, I'll be starting a series of meetings with people to build out a network of social influencers to communicate to people on various platforms who may not have heard our message or need to hear it again. We want to engage the whole community to influence one another to ensure that the advice of the public health officer, the advice of Dr. Henry and all of the other people in public health is followed in BC. We have to engage more, and we're going through that process. Part of that message is about private parties, frankly, which have been a significant source of problems. We have, of course, in our law and in our society, a respect for people's rights within their property. But I have to say this, that if you're thinking of organizing a party, especially one involving alcohol, where there's no specific limits on distancing that you're putting in place, you should not do so. And if you're invited to such a party by a friend, and they are not able to provide such assurances, then whether or not you consider the friendship is one question, but my advice is not to go. and that will be part of the message that we deliver. In addition, this weekend, and I want to make this clear to everybody, that we think that most people who run restaurants, most people who run bars, most people who are working out there are doing a very good job and sometimes are on the front lines of some difficult circumstances, and we appreciate that. But I want to make it clear that this weekend, that if you have banquet halls where private party takes place, you will be seeing environmental health officers and people in public health. And it's our expectation that the limits on the number of people at parties will be in place this weekend everywhere in BC that we can get at. We are going to ensure that that expectation is followed everywhere. And should it not be followed, inevitably, consequences must follow. I report every Thursday on surgery and surgery renewal, and I wanted to say a few things about that. First of all, as you know, on May 18th, we resumed on urgent scheduled surgeries, and this is our 15th update on the surgical renewal commitment. The number of patients contacted about their surgery has increased to 80,278. Between May 18th and August 9th, we've completed 71,512 surgeries. 54,568 were scheduled surgeries, 19,944 were unscheduled or emergency surgeries. That's 13,373 in interior health, 20,121 in Fraser Health, 16,168 in Vancouver Coastal Health, 14,652 in Vancouver Island Health, 4,211 in Northern Health, 2,987 in the Provincial Health Services Authority. Last week, we reported 5,450 surgeries completed in the period July 1st to August 2nd. Health authorities have verified their data, and the total number of surgeries completed for the period was 5,868. That's 268 more surgeries than in the same period last year. This week, we completed 4,718 surgeries. This period included the BC Day holiday, which sees operating rooms perform emergent or emergency surgeries, but not scheduled surgeries. Vacation management is reducing the summer slowdown. We'll especially see this in the month of August due to planned vacations by 52%. I would note that mechanical issues continue at Northern Health, and fixing the issue requires the periodic closure of other operating rooms. Efforts are being made to schedule these repairs outside regular surgery hours. I thank Northern Health for their efforts, and I will continue to report on this until the matter is resolved. A key part of our surgical renewal commitment is to have in place and train 400 additional operating room nurses. This work has started. Northern Health and Provincial Health Services Authority have their training plans in place for their operating room nurses. Vancouver Island Health, Interior Health, Vancouver Coastal Health, and Fraser Health will complete their plans by the end of the month. I also want to express my appreciation to everyone who's delivering on the surgical renewal commitment and the massive undertaking that it is. In particular, today I want to express my appreciation and recognize the leadership shown by chairs and CEOs of BC health authorities who are driving achievement of the commitment. And speaking of the surgical commitment, our commitment to long-term care, I think it's important to underline how important and how much all of you have made that possible, how the efforts made by people across British Columbia have made it possible. And I want to say this, that of course we're all in this together, and this has been part of our message from the beginning. All of us have had part in the success we've had in BC in dealing with COVID-19. And I want to say that if we are not in all this together, we will be challenged in achieving our goals, including goals such as surgery and visits in long-term care, and indeed ensuring in-class education. I want to set aside and just speak for a moment for those of you, by far the vast majority of British Columbians who have been working selflessly, faithfully, and perfectly for months to stop the spread, who have built our BC success, and who are watching the numbers increase with deep disappointment. I say this, don't give up. Do not lose faith. Do not lose hope. Your participation and your leadership have never been more important. We have responsibilities in public health, but it is you who are making all the difference. We're counting on you. I'm counting on you. Dr. Henry is counting on you. We're counting on you to keep making all the difference. And we know the sacrifices you're making and everything you're doing to stop the spread. And I say thank you to all of you. Keeping the door barred against COVID-19 has never been more important than it is right here, right now, and we are the ones to do it. As we go into the weekend, and I've talked about influencers and I've talked about additional action, we have people in our lives, maybe in their 20s and 30s, maybe of other ages. Maybe they're friends, colleagues, neighbors, nieces, nephews, daughters, sons, brothers and sisters, people we care about. Let's be the most effective social influencers we can be and help them stay in our fight and to rejoin if they've drifted. Let's help them to stop the spread by using our COVID courtesy to remind them that we're counting on them to use their COVID sense. Let's tell them we're counting on them and we're reaching out because they can always count on us. Let's make sure they know, as do we, that it's not too late to rejoin the fight. Aujourd'hui, nous annonçons 178 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 4 274 cas en Colombie-Britannique. Il n'y a eu aucun nouveau décès, et je m'en réjouis, lié au COVID-19 pour un total de 196 décès en Colombie-Britannique. Nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Chaque région de santé compte des patients atteints de COVID-19. 1306 se trouvent à Vancouver Coastal, 2242 à Fraser, 150 sur l'île de Vancouver, 398 dans l'intérieur et 106 au nord. Parmi l'ensemble des cas confirmés de COVID-19, 9 personnes sont actuellement hospitalisées, dont 4 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.
Yes, we can hear you.
Or my mute button got stuck. Dr. Henry, we've seen the curve going up for weeks now, and we're seeing it in your modeling again. So I'm just wondering why nothing has changed substantively in response, whether it's tougher messaging, tightening restrictions, implementing fines. I mean, isn't it time to put down the proverbial carrot and pick up a stick at this point?
I think we actually have done all of those things. If you look at the provincial health officer orders, we have put in increased restrictions in those areas where we know transmission has been happening. And we've been working with the industry, particularly in some of the nightclubs, the entertainment venues, restaurants, and they have stepped up. And we're not seeing transmission in some of those places anymore. We've continued with our restrictions around mass gatherings, and as you know, the number is 50. We've done quite a lot of working together with environmental health officers, bylaw officers, WorkSafe BC to do blitzes in different areas. And we've now, we learn more every time. And there's some people out there who are trying to skirt the rules, trying to find ways to get around things and hide things, and we are trying to find them, and we are appealing to those people who know these are happening. Where we know about them, they are being shut down, and this is something that we need to encourage others to police as well, because it will impact all of those businesses if we have to shut people down. And that has been effective, and I may not be as overt about it as some people, but we are absolutely making sure that we are taking the measures that are needed in those places where we're seeing transmission happening.
I think just one point to show the effectiveness of what Dr. Henry and her colleagues do is in interior health. You'll recall we went from 2 active cases in interior health to active cases in the 80s in a short period of time in the first part of July. And action that was taken led by Dr. Henry, led by the team in interior health, but involved the whole community. And today, we're back down to 13 active cases in interior health, and that involved the community, but it also involved the leadership of our health officers. And so our challenge in Metro Vancouver is to also follow that path, because today and in many other days this week, the overwhelming majority of the cases have been in Metro Vancouver. So I believe that this can be done, and we are determined to work with people. But ultimately as well, It depends on the participation of everybody, and we are going to continue to call for that. We can't be in every house, can't be in every apartment, nor does anybody want us to be. So that means that we have to join together as part of a joint effort, and we're going to continue to call for that as well.
Henny, do you have a follow-up question?
Yeah, I do, and it's actually in relation to what Dr. Henry is saying in terms of trying to find these people. When the pandemic first started, the CDC told me that they had been planning for years for something like this, and they specifically had staff looking at social media for early signs of outbreaks. And I'm just wondering, have you pivoted on that strategy? Because I got to tell you, it's not hard to find social media posts at the same locations often again and again where people are partying or big groups are gathering with zero distancing. And I'm just wondering, have you had bylaw or health officials target locations like that based on social media? And could that be an effective strategy just to try to find those younger people that you've been searching out that seem to be the problem demo right now?
The short answer is yes, and it's done in different ways in different parts of the province. And, I think we have to be a little bit careful about demonizing. Most young people are doing the right thing, and they are socially responsible, and they care a tremendous amount about their communities and their families. And so we have to be a little bit careful about tarring everybody with the same brush. But yes, we do use social media. We get reports of things. We investigate a number of, every day there are things that are purported to go on. I also will say that there's a lot of things on social media that are being hashed up and sent around that are not actually viable or true. Recently, I had a number of outraged people send me messages about something that was going to happen and notices, and it turned out it was something from 2017. So, I think we have to understand that social media is what it is. And yes, we absolutely look at those things and we investigate when we hear of them.
Dr. Henry, and also I think Minister Dix as well will want to weigh in on this. Are you worried about increases in hospitalizations based on what we're looking at in terms of those charts? If we increase our contacts, we see the skyrocketing cases. Based on the younger demographic, are there still concerned that it will be putting pressure on our healthcare system?
Oh, absolutely. That is one of the things from the very beginning that we worry about and we have been concerned about, as you know. But that is part of what we're doing with the team at BC CDC and my team and the medical health officers around the province. So there's a couple of things that we look at. We have been looking at the lag time between cases increasing and hospitalizations, and we have not seen that increase in the time frame that we had in the past, so that's good news. We are also watching very carefully, so we have some modeling that can look at the ages of cases and give us some sense of what's going to potentially happen down the road. You may note that in the last couple of weeks I've been reporting on the number of contacts that are in isolation around the province. Partly that's to ensure people understand that it's not just the person who tests positive who this is impacting, it's those people who were exposed, who are in the incubation period, where we have ordered them into isolation, where they can't go to work, they can't go to school, they can't enjoy things with their friends, because they are at risk of developing those symptoms and becoming sick themselves. And that's how we break those transmission chains. But that also, when we follow up with those contacts, we look at the ages that we're talking about. So we have had some spillover into more at-risk populations. We've had some healthcare workers who work in long-term care, for example. We've had correctional officers. We've had other people whose jobs mean that they work with vulnerable people who have vulnerabilities to COVID-19. But we have not seen yet a tremendous spillover. The contacts that we're seeing, the people who have been exposed, are not, they are mostly a younger age group as well. So that's a little bit reassuring, but absolutely, as we have more transmission, more exposure events, the probability increases that somebody's going to take this home to their family, to their granny, to their grandpa, to their long-term care home where they work, the hospital where they work, the correctional facility where they work, the work environment where they may be in close contact with other people. So that's the big worry, and that's why we need all of us to continue to keep our numbers small, small. It is important for us to socialize. It's incredibly important for young people to have those opportunities to be with others. It's part of the joy of our life, but we need to do it differently this summer.
Richard, do you have a follow-up?
I do. I'm just wondering if in these conversations you're having, not just with social influencers, but around designing a strategy targeting towards young people, if one of the things being considered is an ad campaign that shows the effect of COVID-19, like shows to young people what another young person getting the virus looks like, and whether that may be an effective strategy to deter some of this behavior.
First of all, as Dr. Henry has said, today I think the number of people who are under active public health monitoring is 1,878. It was a little higher yesterday. I think it was 1,917. And that's over 1,800 people in self-isolation, not going to work, not going for groceries, not going out for fun, no contact with others, no immunity, no impunity. And so I think to remember that there are significant consequences for all those people, and I think one of the reasons why we're so focused, though, on an approach that involves people is that we need people when they're sick to contact us, to work with us, to do exactly what people in isolation are doing, which is to stay in isolation, and that's really important. The short answer is yes. Part of reaching out to social influencers is to extend the reach of the messages that we're putting out and allow people and encourage people to put in their own terms the messages that Dr. Henry has delivered. And we need, and we're looking to build out that network. In addition to that, we're asking everyone to play their role as influencers because, as noted, this can have profound effects on people, and the people it's likely to most seriously affect are people that you love and people that you know closely, and so those are all strong reasons to follow the advice of Dr. Henry, and we are going to continue to reach out to build messaging, to do so with young people, but to do so with all groups in society, because what's clear to us, and we don't talk about who has tested positive and who hasn't or what, or we're not specific about that. But this is all walks of life who are involved in testing positive, and we need everyone to rejoin the effort. So if that requires broader communication of the message or different communications of the message, of course we're going to do that. Final thing is there are 50,000 people working in long-term care. There's 150,000 people, depending on how you look at it, working in our healthcare system. So when there's transmission in society, that presents consequences for us. That's why we're heartened today that there's no new resident cases today for COVID-19, but we are alive to that and concerned about that. And all of the efforts, and they have been massive efforts to keep people safe in acute and long-term care, are themselves challenged and undermined if we see community transmission.
As a reminder to everybody on the phone, if you have queued up and press star 1 and you wish to ask a question, please take yourselves off mute now. Thank you. Next question is from Ashley Wadwani, Black Press.
Hi, Dr. Henry. So as BC sees more cases, we haven't quite seen the same uptick, obviously, when it comes to hospitalizations, which is what you've shown today. Can you speak to any changes being seen then in regards to the kind of symptoms younger compared to the previous elderly demographic? And could this be in part because the virus is mutating or changing?
Yeah, really good questions. So there's a couple of things. We do know that younger people are very likely to have very mild illness or not recognize symptoms. So that's why we're saying anything, go get tested, particularly if you've been at one of the exposure events and people know who they are. And that's why we're seeing quite a lot of people going for testing. We did over 3,800 tests in the last 24 hours. And, a proportion of those were people who tested positive today. So that is something that we're looking at. So even very mild symptoms, and there's a whole list of them, you can go get tested. Having said that, we also found a very similar thing in elderly people, particularly our elders in long-term care, that sometimes they had very little or no symptoms at all, mostly things like fatigue, or they may have had, they may not have had a fever, for example. So we have adjusted as well to make sure that we test everybody in a care home, for example, if there's a case there. So this virus has proven to be quite stealthy that way, and that makes it a challenge for us. That's why it is so important that we reduce our potential for getting exposed in the first place. In terms of whether the virus has mutated, we haven't seen evidence of that. And a couple of times ago, we presented some of the data on the whole genome sequencing that we're doing of all of the cases in BC. And that's one way of helping us understand. And the thing about this virus that we're seeing around the world is it does change. It mutates, but relatively slowly compared to some other viruses like influenza, which change really, really quickly. So there's a couple of reasons why that's important. It means that immunity is likely to last for a longer period of time. It also means that the chances of a vaccine being effective for a longer period of time and in a broader population is slightly more likely. So that is something we watch really, really carefully. So good questions.
Do you have a follow-up question, Ashley?
Yeah, I do. Thank you. I know we've talked about this in the past, so I apologize if this is a repeat question in a way, but I recently spoke to someone who recovered from COVID. She's a bit younger, and she's still seeing mysterious kind of side effects that doctors aren't really sure if they're directly linked to COVID or from impacts of how her body had to fight it. So for the young people maybe listening to this who don't think they'll be drastically impacted by the virus per se, what do we know at this point about the long-term impacts, especially when essentially a person's immune system is how they have to fight the disease right now?
Yeah, and that's also a really good point. We do know that for some people, and we don't always know who, some of it has to do with the way our own immune system reacts and our genetic makeup. Some people have very severe illness, and some people have long-lasting impacts, even with a milder form of the illness. So they may not have even been hospitalized. They may have had a relatively mild illness. But the things that we're hearing from young people is that fatigue, like difficulty even sitting up, profound fatigue that lasts for a long period of time. For those people who do have pneumonias, difficulty breathing, shortness of breath that can last for a long time. We also know for a subgroup of people, more likely to be men than women for reasons we don't completely understand, that they have increased clotting in their blood, and that can lead to clotting of the arteries around the heart and heart attacks, or it can lead to challenges with brain injury or with what we call pulmonary embolism, so big blood clots in the lungs that can actually happen weeks later. We've also seen in young teenagers and young adults that they can have a post-viral syndrome that can cause inflammation of the blood vessels, and it's been called a number of different things around the world. We have not seen any positive cases yet in BC that have been diagnosed, but we've been watching for it. So this is the MISC syndrome, and we have seen that around the world too. So we are learning more, and we are learning that there can be long-term impacts that can be quite severe, even for young people, and that last, we only have months to go right now, but that have lasted for many weeks and months for some people.
Next question is from Marcella Bernardo, News 1130.
Henry and Minister Dix, I know you've touched on this already, but because the approach BC has taken since March doesn't seem to be working, what action should people be taking when they witness others breaking the rules, such as, you know, if your neighbor's having a party or a banquet, or just what would you tell people to do? Because not everyone should be calling 911.
No, nobody should be calling 911 unless they have a medical emergency. Let's be very clear about that. But there are things people can do. You can certainly, there's bylaw officers that have jurisdiction around parties that are causing complaints and nuisance, etc. However, I do take a little bit of issue with your first statement. I actually think that what we have been doing has worked, and that's why we are where we are. And we know that the things that we have done and would continue to do are working. And it's a very small proportion of the population that are doing things that are causing some of these, the spread that we're seeing. The vast majority of us are weathering this together. And that's what we need to continue to do, and continue to do it in a positive, supportive way, because that's the only way we're going to get through this over the coming months and years. So we all need to take a step back and make sure we don't always know the story of what's happening around us, and we don't always understand the issues that are happening. But if we do have concerns, there are places you can go. I don't know if you want to talk about
that. There's no cure and there's no vaccine for COVID-19. And so we've dealt with this now. We're into our 7th month since we've started doing these briefings, 6.5 months at this point. And I think the overall record of the province is very strong compared to other jurisdictions, especially when you consider the circumstances and jurisdictions around us. And those present challenges for us as well. But we have to continue to adapt at every turn. I talked about interior health earlier, and that involved some changes in public health orders, some changes in enforcement, but also an engagement in that case in the whole population of Kelowna, and including the government in Kelowna and everything else. So we're going to have to adapt again and again and again and again. You saw yesterday the Premier announced 500 new contact tracers. We're developing and are putting in place. In fact, the last month has been, I think, in terms of the work that we've done in the Ministry of Health, the busiest month we've had to date, if you can imagine that, in preparing for what's coming for us coming in the fall, or potentially coming in the fall. And that involves improvements and changes to healthcare capacity so we can help people and support people getting through this difficult period. And you're going to see that reflected in the days and weeks to come. So I think we're going to have to continue to adapt. And that same question of the need for adaptation can be asked in September and October and November and December and January, that we're going to have to continue to do that. And fortunately, we get unbelievably effective guidance from our provincial health officers, from our medical health officers and the health authorities, and from our outstanding team in the Ministry of Health led by Steve Brown.
Do you have a follow-up question, Marcella?
Yes, it was for Minister Dix. Thank you for interjecting there. I was hoping to ask you, because I just checked today that WorkSafe BC hasn't issued a single stop work order, but earlier in your comments you mentioned that if you are having a banquet or if you are having a large gathering, expect someone to show up. So how is that going to work? And hasn't it been done up until now that an environmental health officer or a public health officer would have shown up if there's a large banquet hall having a wedding or something in an area where you're not supposed to?
Yeah, so I'm not sure what statistics you're referring to, but there's ways that we approach the implementation of the regulations. So WorkSafe and public health, we take an educational approach, but there have been workplaces that have been shut down. There have been bars and restaurants and facilities that have been shut down. So that, and it continues. We don't want to do that, because we know that, we saw some of the statistics here. The people who are differentially affected by shutdowns in certain industries, particularly in the sectors that we're talking about, are overwhelmingly racialized women. So we need to make sure that what we're doing is going to support those people and get them back online. And we were working with the industries to make sure that things can be done safely. And yes, there is a program to monitor that.
And Marcella, just to be clear, what I am saying to people this weekend, particularly with respect to the unequivocal provincial health order on gatherings and the limit of 50 people, is that they can expect to be visited in what are essentially private parties in public halls. They can expect to be visited, and the rules will be enforced. And that will have consequences in the future, because it may not be reasonable or possible to shut down an event, and that might not be the most desirable thing, but it will have consequences. And so what this is warning in advance this weekend of what can happen, and our expectation that the rules will be followed in those places.
We have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released shortly. For recommendations on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. Last question is from Georgie Smith, CBC.
You referenced the concerning reproductive rate, and with the upwards case projections, you said that we have it in our ability to make the changes we need. What would those changes be if this keeps up, and what is the indicator or tipping point?
Well, there's a number of indicators we watch, and the changes are making sure that we're stopping those gatherings that are leading to transmission, and we know where those are. People who are holding those know where those are, and also just going back and reminding each of us that it is important that we're doing the things that we're doing, keeping our groups small, not having large numbers of people where this can be transmitted rapidly, making sure that if we have been traveling to places that we're, particularly outside the country, that we maintain our quarantine when we come in. Those are the places that we're seeing these transmissions happening. So there's a number of things that we watch. Obviously, we're watching the reproductive number. That doesn't change day by day, but it changes over time, and we watch that carefully. We look at the age group of the cases, where they are, whether they're linked. Those are really, really important metrics, and those are the things that, as my colleagues know, that we talk about on a daily basis about, what are the worrisome things. We also look at a number of other community, and we have to put this in the context that we still have very low community transmission rates. In the U.S., for example, the U.S. CDC has a number of indicators that they look at for reopening, and one of them is for schools, that you have less than 5 cases per 100,000 population. Many of the counties in the states that open schools, like Georgia, for example, the rates were way above that. And not surprisingly, that was reflected in what was seen in outbreaks in the school. We look at the percent positives of our laboratory tests. How many tests are being done? What are the positivity rates by age group, by different sectors? So those are things that we monitor on a daily basis. And a weekly basis, some of them, and so it is a suite of things. There's no one thing that says we have to do this or do that. It's making sure that we're monitoring a number of different things and having that situational awareness, understanding of where transmissions are happening, and then having the discussions about what we need to do to stop those types of transmissions.
Do you have a follow-up, Georgie?
I do. Some are calling for nightclubs and bars to be closed entirely, given the increasing number of exposures involving nightlife venues. You've imposed stricter public health orders targeting those places, but we've continued to see cases at those venues. So at what point do you close them, even temporarily, to stop the party spreading? And given that this is where new cases are originating, would you expect to see a flattening of the curve after doing that? And an answer in French too, please.
I will say here in BC, after we've imposed those stricter restrictions, we've not seen large numbers of transmission events. And so, yes, we have closed venues when we've seen, so here in BC as well, every business has to have a COVID safety plan. And so that is what we hold people to. And we have found places where those plans are inadequate, and those places are shut down until such time as the appropriate plans are put in place. So we are working with the industry, and the nightclub industry in particular. They have obviously an interest in making sure that people are playing by the rules so that they can all stay open. We are not at the point where we're seeing that we feel that we need to shut the entire industry down. Obviously, that's something we watch carefully.
And just say briefly in English, just to acknowledge the work being done by people who work in those industries, who sometimes are at the front of ensuring that public health orders and COVID safety plans are enforced. And want to express my appreciation for them and our strong request to everyone to be respectful when people ask you to do that, because they are doing their jobs and they are playing a vital role in public health when they do so. Il faut trouver le cible propre.
Dr. Bonnie Henry and Health Minister.
Nous avons vu depuis quelques semaines des soirées privées qui sont un problème. C'est pas forcément dans les boîtes ou les restaurants ou des bars où des gens travaillent ou qui ont une responsabilité pour assurer que le plan contre le Covid-19 est en place, mais plutôt dans des maisons, dans des autres locales où il y a des soirées privées. Donc, c'est un travail difficile, mais nous allons continuer à assurer une démarche respectueuse mais sérieuse à l'égard des ordres du Dr Henry et des registres de santé en Colombie-Britannique. Et je pense qu'on est sur le bon chemin et il y a du travail à faire. Merci beaucoup. Thank you very much.
Thank you.
Until Monday.